Another important discussion that we often are having with patients who are considering undergoing surgical management of breast cancer is unilateral versus bilateral mastectomies, or a mastectomy on one side and a mastectomy on both sides, both breasts. And I should say that very frequently people refer to that as a double mastectomy. So if I say bilateral mastectomy, interpret that as a double mastectomy, as many people refer it to. I'm just more used to saying a bilateral mastectomy. Either way, the decision to have a unilateral or a bilateral mastectomy is one that discussion needs to occur primarily between the person who's performing the mastectomy and the patient themselves. That is the breast surgeon and the patient. And some of the considerations that are made when that decision is considered are the following. One, does a patient have cancer on both sides? I guess in many ways that's a no-brainer. Obviously, if the patient has cancer on both sides, there needs to be consideration to whether there needs to be a mastectomy on both sides. But how about a patient who only has cancer on one side? What would be some of the reasons to undergo a bilateral mastectomy? Well, if a patient has a genetic predisposition to breast cancer, that patient may choose to have a bilateral mastectomy. Often that is recommended. So if, let's say, someone is BRCA positive, they may choose to have a mastectomy on the side that has cancer and then the contralateral non-cancer side in order to have the best reduction in their risk of cancer. Now, I should say there are some patients who are BRCA positive who have breast cancer on one side and elect not to have a mastectomy on the contralateral side, at least at the time of the mastectomy on the cancer side. The reason for that is, let's say, a young patient who plans to have children and would like to breastfeed their child. Those women do, and this is a relatively rare exception, those women will sometimes go on to have a mastectomy or reconstruction on the side that had cancer, go on to have children, breastfeed their children, and then after they have had their children and have completed their breastfeeding, will go on to have a mastectomy on that side to reduce their risk because of the BRCA positive status. Now, another reason that women choose to have bilateral breast reconstruction is just anxiety and fear. It's very understandable that a woman who has breast cancer on one side and has to have a mastectomy never wants to have a mastectomy again, never wants to have to deal with having a mastectomy and a breast reconstruction or breast cancer again. Women in that category often choose to have a bilateral mastectomy, and that's a very reasonable choice. I think that there are a lot of important statistics with regard to the potential to getting an opposite side breast cancer after unilateral mastectomy and treatment those statistics need to be discussed with the breast surgeon, but certainly those are some of the reasons that is one of the reasons that women do go on to choose to have a bilateral mastectomy. Some of the reasons that women choose to have a unilateral mastectomy, unless they need to, for oncologic reasons, have a bilateral mastectomy, some of those reasons that people have a unilateral or a one-sided mastectomy and reconstruction is that they want to preserve sensation in the opposite side. Two, they don't want to have any more surgery than they need to. And then another important consideration is that by only having a mastectomy on one side and a breast reconstruction on one side, you're certainly decreasing the potential for complications. I think it'd be erroneous to say that having a bilateral mastectomy is 2 times the risk of complications from the mastectomy and the reconstruction in comparison to a unilateral mastectomy and a unilateral reconstruction. But there certainly is an increased risk by having both sides operated on. I think that only stands to reason.